This systematic review evaluates the clinical efficacy, safety, and cosmetic outcomes of topical 5% Imiquimod cream for superficial and nodular basal cell carcinoma in the periocular region. 7 studies were analyzed, including 1 randomized controlled trial. IMQ achieved a pooled clinical plus histological clearance rate of 82%, with the RCT showing 100% histological clearance at 3 months. This is comparable to radiotherapy. Better outcomes were achieved with smaller lesions and superficial subtypes. Long-term control was sustained in most cases up to 5 years, especially when histological clearance was confirmed. A combination approach yielded 87.5% sustained remission. Local adverse effects, including erythema, crusting, and edema, occurred in 70 to 90% of cases but were mild to moderate and self-limiting. Ocular complications such as conjunctivitis or keratitis were reported variably, but were transient and non-severe. No systematic side effects or treatment-related vision loss were observed. Cosmesis was superior with IMQ compared to radiotherapy. Lesions healed with minimal scarring and preserved eyelid function, making IMQ favorable for tumors in aesthetically sensitive periocular locations. Although formal patient-reported outcomes were limited, overall satisfaction was high in studies reporting on appearance and tolerability. IMQ offers slightly lower clearance rates than Mohs surgery, but has results comparable to radiotherapy and has clear advantages in cosmetic outcomes. It is best suited for patients who are not surgical candidates or for tumors near the medial canthus or eyelid margin. Most studies included were small, observational, and heterogeneous in protocol and follow-up. Only 1 was a randomized trial. Histological confirmation of clearance varied, and long-term recurrence data were limited. The certainty of evidence was rated moderate for short-term efficacy, but low to very low for long-term outcomes in cosmesis. Topical 5% Imiquimod is a valuable non-invasive treatment for selected cases of periocular, superficial, and nodular BCC, particularly when surgery or radiotherapy is contraindicated or cosmesis is a priority. While well tolerated and effective in the short term, larger trials with standardized methods and longer follow-up are needed to establish its role more definitively.